So for the next part, we're gonna also introduce the nuclear medicine imaging, right? Basically PET aspect. So the nuclear medicine is a medical specialties that use radioactive tracers to access body functions. So again, so this nuclear medicine imaging is also trying to analyze the function, right? Not the anatomical structure. So it can be used to diagnose and treat disease, and it has specially designed cameras allow doctors to track the path of these radioactive tracers. Okay. So for this nuclear medicine imaging, the two common ones are the single photon emission computed tomography, right, SPECT, and or the positron emission tomography, right, PET scan. Okay, so these are the two common imaging modalities in nuclear medicine. So for the SPECT imaging, right, so here's the basics for SPECTs. So these imaging instruments will provide, again, three-dimensional images of the distribution of the radioactive tracer molecules, right? So basically, we are using these cameras to detect the trace of the radioactive tracer we given to the body, right? So this tracer is what allows doctors to see how blood flows to tissues and organs, right? Just as shown in the this image, right? You can see how the blood flow is distributed across different tissues and organs of the human body. And this SPECT imagers have gamma cameras detectors, can detect the gamma ray emission from the tracer. And the tracer is radioactive, right? Which means your body is exposed to radiation. So this exposure is unlimited, however, because the radioactive chemicals have short half-lives, and also you are given very tiny amount of the dosage, right, for this radioactive tracer. So they break down quickly and are removed from body through kidney. Okay, so don't be very scared when you heard of this kind of nuclear medicine, right? Because the doctors can control the dosage, and this can also be partially can be break down by the human body. And we also have the PET imaging, right? So the main difference between the SPECT and the PET scan is the type of radio tracers being administered. Okay, so they have different tracers for PET and the SPECT. Okay, so the SPECT scans measure gamma rays, but for the PET scan, so they're using the decay of the radio tracer, for the PET scan. So it will produce small particles called a positron. So a positron is a particle with roughly the same mass as the electron, but oppositely charged. So these react with electrons in the body, and when these two particles combine, they annihilate each other. Okay, so this procedure will generate a small amount of energy in the form of two photons. They shoot out in opposite directions. Okay, you have two photons, and they have opposite directions. So these energies can be detected by the PET scanner. So they can be used to measure the information and generate the images of the internal tissues or organs. Okay. And sometimes you can see different modalities are combined in a single scanning machine, right? So we can do PET and the CT or MRI and PET for the hybrid imaging, right? So here is the PET and the CT hybrid imaging, right? So for the CT, we can clearly show the kind of structure of the body, right? And with the PET image overlay, we can also see how the function, right? Maybe the blood flow, or maybe the metabolism procedure, right? The process. And on the right, is the hybrid imaging of MRI and the PET. So again, we can using these two modalities to have better diagnosis. Okay, so so in this case, we have also, this is a clinical use of PET, right? So we have the CT image, and on the right is the fused CT and a PET image. And this can diagnose and also monitor the growth of some of the cancerous tumor, okay? And this is image show, right? We want to do this kind of hybrid imaging, right? So before you will just put maybe two system, right, side by side, right? You first go to the PET, maybe then go through the MRI machine, so in a sequence. But now we can, combine these in a single machine, right? You can do this simultaneously. Okay, so in this video, I'll show SPECT and CT scan animation, right? So you can do CT and SPECT scan at the same time. And let's take a look.
A SPECT scan is used to assess the function of tissues or organs in your body to identify disease. A CT scan provides your doctor with high-resolution images of structures in your body. In other words, SPECT assesses physiology and a CT assesses anatomy. Today, generally a SPECT CT scan is performed where the images from the two different types of scans are captured during one session using a hybrid scanner, and the images are combined. Each piece of information is important, but when combined, they are even more useful. A SPECT CT scan is undertaken in two parts: the administration of the tracer and then the scan that shows how the tracer behaves in your body. A nuclear medicine is generally administered through an intravenous injection, but can also be inhaled, swallowed, or injected in the skin. What study you have will decide how the tracer is administered and whether it is done lying down on the scanner or elsewhere in a chair. The injected nuclear medicine gets taken up and concentrates in the part of the body under investigation. Some diseases cause increased function, some cause decreased function, and some cause changes in function, all of which can be imaged on the scanner. Virtually all organs and tissues can be investigated using nuclear medicine. The most common procedures include the bone to detect and assess changes in bone function associated with cancer, trauma, and metabolic changes, and many other diseases. The function of the heart can be evaluated by examining blood moving through the heart or imaging the blood flow and movement of the heart muscle itself to diagnose a variety of diseases. Nuclear medicine can also be used to study lung, kidney, thyroid, brain, and many other organs and tissues in the body, and importantly, to investigate cancer. Because some body functions are fast and some are slower, the time between administration of the tracer and the scan can vary from minutes to hours. Some people may even be required to come back on multiple days. For diagnostic scans, the nuclear medicine is radioactive and emits gamma rays that can be detected by the scanner. The SPECT CT machine has two gamma cameras that detect gamma rays and produces a map of how the tracer is behaving. These detectors rotate around the body, taking images every few degrees, allowing images to be reconstructed in 3 dimensions. The SPECT scan can take 10 to 20 minutes, and then the CT scan takes less than a minute. The scan collects important information that is processed by a computer. This information is then carefully reviewed by a specialist nuclear medicine physician to produce a report for your doctor. Your doctor will use the information to help determine how to manage your specific health condition or assess the response to current management.
Okay, so if you are interested to know more on this nuclear medicine, so actually this is a very good presentation. So you can look at this video. Okay. So in summary, right? So we can do a comparison, between nuclear medicine and the radiology, right? So X-ray, CT. So for the nuclear medicine images, organ function, right? For radiology, you'll access anatomy, okay? For nuclear medicine, it will use radioactive drugs, right, which will injected into patients' bloodstream, and images are then obtained based on the radioactive decay of the tracer drug. But radiology using an internal source of energy, right, either the ionized radiation, or you can using radio waves and a magnet field. Okay, so these are some of the key differences between nuclear medicine and radiology. So I think so far we've talked about these popular imaging models.